everyone, my name is Alexandra Reynolds, and I'm going to discuss three major concepts of developmental psychology. Developmental psychology is the scientific study of how and why human beings change over the course of their life. Originally concerned with infants and children, the field has expanded to include adolescents, also known as teenagers, adult development, aging, and the overall entire lifespan. Developmental psychology involves a range of fields such as educational psychology, child psychopathology, forensic developmental psychology, child development, cognitive psychology, ecological psychology, and cultural psychology. The first concept I'm going to discuss is child development. Child development is one of the many branches of developmental psychology and is one of the most frequently studied specialty areas. Child development focuses on the mind and behavior of children from prenatal development through adolescence. Child psychology deals not only with how children grow physically, but with their mental, emotional, and social development as well. The main three stages of a child's life include early childhood, middle childhood, and adolescence. The period of early childhood typically ranges from infancy to the age of 6 years old. From birth to 18 months, babies grow and change rapidly. During the first 3 months of infancy, babies begin to show interest in objects, smile at people, become aware of noises, cry differently for different needs, and grasp objects. From 4 to 6 months, a baby begins to respond to signs of love and affection, laughs, responds differently to different voice tones, reaches for items, and rolls over. From 5 to 9 months, a baby may start to bring hands to their mouth, enjoy mirrors, know when a stranger is present, respond to hearing their name, communicate with gestures, and sit without support. From 9 to 12 months, they look for hidden items, may become clingy to familiar people, points, understands the word no, imitates sounds and gestures, and crawls. From 12 to 18 months, he or she has learned how to use utensils, may cry around strangers, may have tantrums, knows how to say several words, waves goodbye, stands alone, and walks holding surfaces. During the course of development, the individual human progresses from dependency to increasing autonomy. It is a continuous process with a predictable sequence. Development does not progress at the same rate, and each stage is affected by the preceding developmental experiences. There is speculation that middle childhood, or ages 6 through 12, are the most crucial years of a child's life, ranging from the starts of some sorts of formal schooling to the beginning of puberty, and this is also the period where many children start to gain more self-awareness. Between the ages of 6 and 12, the child's world expands outward from the family as relationships are formed with friends, teachers, coaches, caregivers, and others. Because their experiences are expanding, many factors can alter children's actions and impact how they learn to get along. Some situations can create stress and affect self-esteem. The middle childhood period is a time to prepare for adolescence. Adolescence is the stage of life that typically starts around the time puberty hits, all the way up until legal adulthood. It is usually associated with the teenage years, but its physical, psychological, or cultural expressions may begin earlier and end later. The early developmental phase usually encompasses preteens ages 12 to 14 and marks the majority of puberty-related changes. Ages 15 to 17 often mark the middle developmental phase in which many of the physical changes have already taken place. Finally, the late stage of adolescence physical development occurs between the ages of 18 to 21. This is a period in a young adult that brings sometimes intense physical, social, and emotional changes. Physical development in adolescence includes a growth spurt as the body fills out, voice changes, especially in males, and an increase in sex hormones, such as women begin to develop breasts and encounter their first menstruation, while men begin to develop facial hair. A teenager facing the social developmental stage will become more aware of themselves and their identity. This is a time when they form an ego identity and attempt to figure out who they are and what they stand for. During their development, they will also face gender differences in behaviors or mental processes along with becoming aware of their gender identity. Gender identity is actually usually recognized at the age of 3. When a child becomes aware of their gender identity, they adapt their behavior and thoughts to their specific gender roles. A gender role consists of the thoughts or behaviors associated with a person's gender, such as girls doing activities like getting their nails done and boys playing video games with their friends. Most often, men and women tend to conform to gender role stereotypes. However, in some cases, a male or female can adopt the behaviors associated with both males and females. Such examples of these behaviors include men performing physical labor and also being able to bake, and women caring for babies and being an engineer. This is defined as androgynous. Adolescents also face problems that are many and often involve the adolescents' relationships with their peer group as well as their search for identity. They may face peer pressure, encounter substance abuse, eating disorders, and other psychological disorders such as depression and anxiety. Considering the final stage of adolescence occurs between the ages of 18 to 21, this concludes our section on child development. The next concept I am going to discuss is adult development. Now, I believe that most development for a human being occurs during the childhood development stages, therefore this segment will be a little bit shorter than the segment on childhood development that I previously discussed. This developmental stage occurs from the end of adolescence until the end of one's life. The key stages that are emphasized during adulthood include the early adult transition, which occurs between the ages of 16 through 24, forming a life structure between the ages 24 through 28, settling down during the ages of 29 through 24, becoming one's own man between the ages of 35 through 40, midlife transition in the early 40s, and restabilization into late adulthood from age 45 and on. As an adult, one will face physical changes, also known as aging, which are completely normal. Physical changes may include the degeneration of muscle, bones, and joints. Along with physical changes, sensory changes are common in midlife. Sensory changes tend to affect one's vision, hearing, taste, touch, and smell. Unfortunately, there are certain illnesses that are associated with aging as well, such as cancer, arthritis, cardiovascular disease, and infections in their immune system. During the sensitive current time we are living in, studies have even shown older people are more likely to test positive for COVID-19. Here is a short clip as to why older people are more easily affected and endangered by the coronavirus.
That cause the aged immune system to be much more vulnerable to new threats, such as COVID-19. First, as we age, we start to produce less new immune cells that are able to respond to new sorts of infectious disease. Secondly, as we age, the immune system has a delay in its ability to coordinate itself. There is a delay in the communication among all the different types of immune cells. And so the aged immune system is much more slow at clearing an infectious disease. Also by sneezing into our elbow or coughing into our elbow to avoid spreading germs on our hands, and also encouraging our elderly to have healthy lifestyle choices such as getting enough sleep, being hydrated and nourished, and also maintaining social interactions with them so that we can tell if there's a difference in their health status.
As we begin to talk about the elderly, we are going to actually transition into our third major concept, which is the elderly developmental stage. Human beings are considered in late adulthood from the time they reach their mid-60s until death. Now, there are some stereotypes of quote-unquote old people that makes younger adults dread reaching old age. These stereotypes include all old people get wrinkles, shriveled skin, weakened muscles, must need a walker, lose hearing, and many more. However, like all stereotypes, these do not apply to everyone. With aging, however, does come many physical changes. People typically reach the peak of their physical strength and endurance during their 20s and then gradually decline. In later adulthood, a variety of physiological changes may occur, including some degree of atrophy of the brain and a decrease in the rate of neural processes. The respiratory and circulatory systems are less efficient, which can lead to illnesses. Bone mass diminishes, especially among women, leading to bone density disorders such as osteoporosis. Muscles become weaker unless exercise programs are followed. The skin dries and becomes less flexible. Hair loss occurs in both sexes. There is also decreased sensitivity in all of the sensory modalities like mentioned before, including taste, touch, hearing, and vision. When it comes to the end of one's life, there are certain reactions that a person of older age may perform, such as denial of reality, anger and self-pity when they ask, "Why me?" or "Why am I the one that has to die?" Bargaining, when they plead to God or others one last time, depression, and acceptance, when they finally accept the truth about their reality and find peace with the inevitable. People who are dying are sometimes placed in a hospice, or a hospital for the terminally ill, that attempts to maintain a good quality of life for the patient and the family during the final days. During the final days or last 2 weeks of a person's life, one may experience some mental and physical changes before death. Such changes may include excessive sleep, lower body temperature, irregular pulse, lower blood pressure, disorientation, increased perspiration, and skin color and breathing changes. As that concludes my final concept of development, I thank you for watching, and I hope you were able to take away some informative information about the different stages of development. Thank you.